In this video, we will be going over what is diabetes. We'll go over the different types and some information that you should know to understand what is going on in your body. To best understand what is happening in our bodies when we have diabetes, we first need to take a look at how our bodies are supposed to work and what happens when you do not have diabetes. So when you eat food, your body breaks down a lot of that food into a type of sugar called glucose. To keep things simple, we can just call this sugar. This sugar is your body's favorite source of energy. So the sugar gets taken into your blood to be delivered to the cells of your body for them to use for energy. In a person without diabetes, the pancreas makes insulin, which works like a key to open up the cells. This allows sugar to move out of the blood and into your cells. So let's talk about what happens when a person has type 1 diabetes first. Now, type 1 diabetes used to be called juvenile or childhood onset diabetes because it does usually start in childhood, but today we just refer to it as type 1 diabetes. Type 1 diabetes is an autoimmune condition where the pancreas stops making insulin. Without that key to open up the cells, sugar begins to build up in the blood, causing high blood sugars. This also means that the cells are not getting the energy that they need. Like I mentioned, type 1 diabetes usually starts in childhood, and its onset is pretty fast, meaning people get severe symptoms very rapidly. And the primary and in fact life-saving treatment for type 1 diabetes is to take insulin. It is also helpful for people with type 1 diabetes to be mindful of their overall health to keep the insulin that they take working as well as possible. Now let's take a look at type 2 diabetes. Type 2 diabetes is by far the most common type of diabetes, and it did used to be known as adult onset diabetes, but now we know it can happen in kids too. And like I mentioned, it's by far the more common type, and for that reason, most of the time when people, including myself, if we just say diabetes, we're referring to type 2 diabetes. In a person with type 2 diabetes, the pancreas is still making insulin, but something is blocking that insulin from properly opening up the cells to move sugar out of the bloodstream and into those cells. So just like with type 1 diabetes, blood sugar increases while the body's cells are still left hungry for energy. In type 2 diabetes, the pancreas can still make insulin, so it actually starts to make more and more extra insulin to try to compensate for it not working as well. The insulin starts working less and less well over time. We call this insulin resistance, and the pancreas tries to make more and more to keep up. Eventually, though, the pancreas gets tired out and starts being able to produce less and less insulin. And that is when diabetes finally gets diagnosed, even though this process may have been started up to a decade before. Now, some people may have a specific event that pushes their pancreas over the threshold of actually having diabetes. Some examples might be getting sick. We are seeing this a lot with COVID now, or having a baby or just being pregnant, or someone that may need steroid medications. It can push their body over the edge into the range of having type 2 diabetes. Now, on that note, if you do have high blood sugars while you're pregnant or while you're on steroid medication, it's possible that once those events are over, you could go back into normal ranges. And that is just a heads up of where your body could be heading. Eventually, you will likely get over that threshold of having type 2 diabetes if you have high blood sugars when those more stressful situations are happening. But at any rate, other people just gradually progress to the point of getting diagnosed with diabetes. Either way, the same mechanism is involved. Insulin resistance results in the pancreas making more and more insulin until the pancreas tires out and can't keep up anymore, and then diabetes is diagnosed. So the treatment of type 2 diabetes has a big focus on lifestyle changes to help insulin work better. However, when lifestyle isn't enough for whatever reason, a variety of medications are also available for treating type 2 diabetes. And additionally, if your pancreas gets to the point of not making any insulin or just not able to make enough to keep up, people with type 2 diabetes can also take insulin. And a lot of people do get to that point, unfortunately. So the big question with type 2 diabetes is, what is causing that insulin not to work properly? And what research has shown is that there is something blocking the insulin. I mentioned the insulin is like a key. Well, there is something gumming up the lock. And what we know that to be is something called intramyocellular lipids. And that is just a fancy word that means fat stuck inside of your muscle cells. When there is a certain type of fat clogging up your muscle cells, the insulin cannot open those doors to move sugar out of your bloodstream and into your body's cells for energy. So in summary, type 1 diabetes is an autoimmune condition that starts in childhood, where the pancreas stops making insulin and insulin must be taken. Type 2 diabetes is when insulin resistance progresses to the point that the pancreas tires out and eventually starts making less and less insulin. There are several other types of diabetes, and it's estimated that up to 1 out of every 10 people are actually misdiagnosed with the wrong type of diabetes. So it's really important to make sure you're confident in your diagnosis. And that is something that I would be happy to talk to you about if you feel like there's a chance you may have gotten diagnosed with the wrong type of diabetes. A couple of indications of this would be if you were diagnosed over the age of 40 and lifestyle changes don't seem to be helping your blood sugars at all, that would be a sign that you may actually have LADA instead of type 2 diabetes. Okay, I'll see you in the next video.